The 20,172,018 influenza season is appearing as though one of the most exceedingly awful in years. 46 states are detailing across-the-board influenza action, the Centers for Disease Control and Prevention said. From October 1 through December 30, 3,927 individuals were hospitalized because of seasonal influenza. The most noteworthy hospitalization rates were among grown-ups more established than 50 and youngsters more youthful than 5. As such, runs to get immunized. A yearly influenza immunization is the most ideal approach to keep this season's cold virus, the CDC says. However, how would you approach getting inoculated in the event that you don't have medical coverage? Also, in case you're sufficiently unfortunate to get this season's cold virus, how might you treat it? Preventing the flu without health insurance. You may have heard influenza antibody isn't as powerful this year. There are numerous influenza infections, and the transcendent rendition this season is called AH3N2. In past seasons, this infection has been related with more hospitalizations and passings contrasted with other influenza infections. Antibodies likewise have a tendency to be less powerful against AH3N2 than other flu infections. In any case, that doesn't mean antibodies are totally ineffectual. The CDC still says immunization is the most ideal approach to keep this season's cold virus. Besides, said Brian Stager, a drug specialist and author of PharmacyStances.com, contemplates demonstrate inoculations help make indications less serious in the event that you get influenza. Uninsured individuals shouldn't have to pay much for an immunization. While a specialist's visit may demonstrate exorbitant, drug specialists can likewise give you the immunization. A shot from a retail drugstore should cost $20 to $30, Stager said. There are additionally a lot of free approaches to support your invulnerable framework and anticipate ailment, such as washing your hands, eating a sound eating routine and getting enough rest. Treating the flu without health insurance. Influenza can thump you out. I've had it once, and it was gross. My chest hurt, the lymph hubs in my throat swelled like a frog and I was sweating like a murder suspect. Fortunately, it left with a lot of hydration and rest, which shouldn't cost much. For the vast majority, that is the main treatment vital. However, a reasonable over-the-counter medication like Tylenol may help with throbs, Stager said. Note: consult a specialist for your best course of treatment. In any case, for high-chance cases, including individuals who have been hospitalized, individuals with particularly extreme side effects, youthful youngsters and individuals more than 65, the CDC suggests antiviral prescription. This will cost you. Those antiviral medicines are amazingly costly if you somehow happen to pay out of pocket, Stager said. Tamiflu is the most ordinarily recommended antiviral for this season's cold virus. It's additionally sold blandly as oseltamivir and is accessible at most drugstores, costing in any event $108 for a measurement pack, as indicated by GoodRx, a site that accumulates physician-recommended tranquilizer costs. Stager suggested that uninsured individuals inquire as to whether they offered a rebate card or coupon. Almost all real chains offer some sort of rebate on generics, he said. You can likewise get coupons online at sites like GoodRx. For instance, GoodRx has a coupon that brings down the cost of oseltamivir from $108 to $57.44 at my nearby Duane Reade. Influenza is frightful, and this season appears to be particularly terrible. Yet, even without protection, you don't need to become bankrupt battling it. P.S. You can get health insurance. Open enlistment is shut on healthcare.gov. However, you can even now purchase an individual medical coverage. Anticipate 2018 out of a couple of states. Check our state-by-state manual for medical coverage to check whether a trade is as yet open where you. In the event that you've missed the due date, you may likewise fit the bill for a unique enlistment period. Uncommon enlistment periods are for the most part attached to a major life occasion, like a marriage or birth of a child. Beside that, you can consider a transient well-being design, off-trade design. Some private guarantors offer strategies outside of open enlistment, constrained advantages designs or another contrasting option to conventional protection.